Hi, friends. Right now, we want to talk about the medical practice again as it pertains to the political environment of our business. It seems that the candidates are having a debate as to whether we have a right to live or not. Of course, just because we're business majors doesn't mean we're bad people. We think that people have a right to life, and we want the government to assure that as per the preamble to the Constitution. The preamble Constitution says they're going to ensure the blessings of our liberty to ourselves and our posterity. So you don't have much liberty if you don't have a right to life. So anyway, what type of insurance or assurance or insurance are we going to have to secure life for the over 22,000 people that are currently passing away from treatable diseases because they can't get care? The Obamacare only solved half the problem. There's people that weren't covered that are covered, lots of them, but there were an estimated 45,000 people dying every year from treatable diseases because they couldn't get treatment because they couldn't afford it. They didn't have any money. They were dying. That problem's been cut in half to about 22 or 25,000 people, Americans, each and every year dying because they can't get medical care because they don't have any money. The medical system will treat you in an emergency and get you out of pain, but it doesn't treat fatal diseases unless you can pay them. So we have this problem with over 22,000 of our fellow countrymen. Mr. Sanders is talking about a public option, and Mrs. Clinton was previously for single payer, which is more or less Medicare for all. She says she wants to stay with Obamacare now, but as you can tell, Obamacare doesn't solve the whole problem. So, what are we going to do? Do we want a British-style health system where everybody is treated for free and, you actually get money to go for travel expenses and time off of work to go to the doctor? They pay you. They give you some cash for time off of work and medical expenses to go to the doctor. Veterans already have that system here in the United States. If a covered veteran needs medical care, they are paid travel expense to the Veterans Administration and get a small amount of cash for their travel to the appropriate VA medical facility. So do we want a British-style medical system where everybody's treated free, taxes are raised probably 10% or more? They say they don't have socialism in Europe, but what they do is they have about a 40 or 50% tax rate for everybody, and they have several cash benefits and medical benefits for everybody that's covered, everybody that needs them. So, that's what they have in Europe. And so do we want a British-style system where we pay a little bit more in taxes and everybody gets treated free? Or do we want more of an insurance system, which is covered by the Constitution, where the needy get treated courtesy of card or assurance or insurance provided by the government? And the private system, the quote-unquote private system, the HMOs or whatever they call them, and the medical insurance companies, the health insurance companies, are still paid by you or your employer. Which type of system do we want? Or are we just going to continue to let these several thousand Americans just die because they don't have any money to get treated? So that's the options as I can see them. So I would like to advocate that we need to abide in our Constitution and have an insurance type of program based on income and with liberal wealth considerations. very liberal wealth considerations. When we say a system is based on income, that means your yearly income, like your wages or your benefits from Social Security or private insurance or some other benefits you have. That doesn't mean like the value of your home, your stocks, your wealth. The value of your home, your stocks, your car, things like that. As it is now, with the Medicaid system, I think they have a pretty stringent view on how much wealth you can have. I don't think that's fair to people who may just be poor at the time, but are forced to liquidate everything they got to be eligible for Medicare, or they die, Medicaid, or they die. That's if their state offers it. That's if and only if their state offers Medicaid or full coverage Medicaid. Some states don't want to offer full coverage Medicaid. Missouri is one of them. But anyway, so what kind of system are we going to have, and what are our limitations according to the law? Well, the law says that we have a right to insurance or assurance, or as taken to mean insurance. So there is government insurance, there's Medicare, and there's Medicaid for the impoverished. Medicare for the disabled and the elderly, and Medicaid for the impoverished. So what kind of system are we going to have, and what are our limitations? I think that we need an insurance program with liberal considerations for our wealth and liberal considerations for our income. I don't think a person should be absolutely destitute to be afforded the opportunity to save their own life from a deadly treatable disease. Anyway, just remember, it does matter, and thanks, and have a nice day.